2 Americans who are infected with the Ebola virus are headed back to the U.S. Doctors and staff in Atlanta are preparing for at least one of the patients. It'll be the first time a patient who has the virus will get treatment in the U.S. More than 700 people have died across Western Africa because of the virus. The CDC says there is no need for people in the U.S. to worry about Ebola. And while health officials say the chances of the virus reaching Northeast Indiana are extremely low, we are told the area would be equipped to handle it.
News Channel 15's Alyssa Imanson joins us from Studio 15 with another of tonight's stories for your well-being.
The Ebola outbreak in Africa is a worldwide concern, and now the CDC's issued a travel alert for 3 countries. While we really don't need to be worried here about contracting Ebola, health officials are still prepared.
And highlights that we're all one plane ride away from some really devastating illnesses.
The Ebola virus outbreak in parts of Africa has killed more than 700 people and sickened 1,300 more since March.
When you're living in crowded conditions, as you see sometimes in these countries where there's a lot of poverty, you can see a lot of transmissions.
The Ebola virus is spread through contact with blood or other bodily fluids. There are strict guidelines if an infected person is in an American hospital.
And that guidance has been out there from the CDC in terms of all the precautions that every person who assists this patient in a hospital, healthcare worker, laundry, food workers, those kind of folks, they have a set of protocols, infection control measures that will be implemented to prevent infection from this person.
Allen County Health Commissioner Dr. Deb McMahon says if you feel sick, it's always important to tell your doctor about any travel, even if it was several months ago.
People have to know where you've been because as you're seeing, things are popping up no matter where you travel. You live in a living environment. If there was any concern, what they would do is immediately put that patient in quarantine, would contact the health department, and of course we would work with our state and federal public health officials to do the proper investigation.
McMahon says the health department and healthcare providers have good communication. She's confident they would be prepared if someone came to them with symptoms of Ebola.
You guys would be surprised at how many different scenarios these people deal with on a regular basis where they're dealing with people who are potentially infected with other things from traveling.
Anytime you do travel outside the United States, health officials say you should also check any travel or health warnings on the CDC's travel website. For Stories for Your Well-Being, I'm Alyssa Imanson.